If you're lean, you've probably been told that you're not a good candidate for fat transfer because you don't have enough donor fat. Or maybe you just don't want any implants, you don't want anything synthetic or foreign in your body. So this is a very good option that I didn't have for you before. And it's not just for breast, it could be for hip dips, irregularities after liposuction, or even butt augmentation. So if you want natural volume anywhere on your body without surgery, without anesthesia, or without implants, this amazing technology is worth knowing about. AlloClae is a purified human fat tissue and is processed, sterilized, all DNA removed, and irradiated for safety. It was launched in early 2025, but honestly I waited because I want to see real-world results before I introduce it to my patients. That's just how I practice. And so far, the safety profile has been very reassuring, and I'm now confident offering it in my practice. Let me show you. This is AlloClae straight out of the syringe. Look at the consistency. This is not a synthetic gel. It is real tissue. That's why it integrates the way it does. I know what you're thinking. 3 things. 1, is it safe? The processing removes all donor material that could trigger a reaction. So what's left behind integrates with your own tissue. It feels like fat, it behaves like fat, because essentially it is fat. 2, what about the redness after? Some patients do report a mild histamine response, and it usually resolves quickly, usually with an antihistamine, and it's not an infection. 3, how much can you add in one session? This is where I'll give you my honest clinical opinion. I prefer a staged approach. Smaller volumes, spaced out, let the tissue integrate. You'll get a more natural result and a safer one. You don't need general anesthesia, it's an in-office procedure, and you don't really have much of a downtime. It won't replace surgical augmentation if you want a significant size increase, but if you want a natural enhancement, especially if you have no fat to give, this is genuinely promising.